Prevention Point has always listened and tried to be responsive or even proactive about needs in the community, as opposed to paternalistic and kind of imposing.
Before syringes could be legally purchased, people wanted access to sterile syringes. The needle exchange program was truly the only resource. People would line up outside of the door.
There were people who ran shooting galleries in the Hill that would come in and get large quantities of supplies and basically do secondary needle exchange through the shooting galleries.
When you understand how a disease gets from one body to another, you understand what that mode of transmission is, you figure out how to interrupt that transmission. Well, when we find out that one of the ways that HIV is transmitted is through the sharing of syringes, it is just the simplest, plainest logic that you do that by preventing the reuse of syringes.
Instead of just having our one Sunday site, we now have 5 of those that operate in different neighborhoods in the city, and they all have their own little community around them.
We've identified that overdose was killing more people than any other accidental form of death.
A way to deal with the overdose problem was to distribute the drug naloxone, which goes by the brand name Narcan, which is an utterly harmless drug, but if you have opiates in your system, it immediately reverses the effect of them.
The main way that we give out naloxone is at the syringe exchange sites. We started giving out naloxone in 2005. Initially, we were only able to do it at the syringe exchange sites where we had a physician or another prescriber coming every week to be able to physically sign every prescription for naloxone, because that's what we had to do legally. We worked with people from other parts of the state to get a state law passed, Act 139, which allowed third-party prescribing, so we didn't have to have them signing individual prescriptions, and it could be done at other places where there wasn't a physician present, and it was legal to prescribe it to somebody who we knew would be using it on someone else.
If you give them the technology to help themselves, they have very often the level of empowerment to take that technology and that knowledge and use it. It moves people away from a sense that I'm powerless, that I can't do anything over my addiction, and moves them into a place where they feel like, I do have some power over this. And sometimes that kind of realization has moved people towards recovery, towards better health, towards safer drug use, and being alive today.
As COVID restrictions were going into place in March, we started noticing people stating that they were hungry or that they hadn't eaten. And we always have snacks and usually some water, and people were asking us for the whole box of granola bars. We said, we have to do something. We know that there's food distribution happening, but what else can we do? We got an unsolicited donation of $5,000 from a family foundation. It was totally unexpected, and we had just started the process of applying to become an emergency food distribution partner of the food bank. They warned us that it was going to take some time because they had a lot of requests and there's, a vetting process. But the importance of getting food to our people, it just pales in comparison to any discomfort or extra work that we're going to have to put in to do it.
People trust us with their lives and with their privacy and with their dignity. There's no more of an honor than that.